Hi, welcome to the Fit and Healthy Today show. And today, as promised, our topic is on hypothyroidism. That means basically an underactive thyroid. Now, when your thyroid is underactive, all these symptoms down here occur, but first I want to review through what the causes of hypothyroidism or underactive thyroid are. Iodine deficiencies. Iodine used to be found really heavily in our iodized table salt, but now all the docs and everybody else are saying to limit the salt. So with the limitation of salt, we're ending up oftentimes with an iodine deficiency. Or we're ending up with things that block iodine uptake. And that would include chlorine in our water, fluoride in our water, fluoride found in pesticides and chemicals. Those halogens on the periodic table, remember that from high school, block the uptake or the receptors for iodine. So you can end up actually with a hyper or hypothyroid problem. Very important to recognize that if you're nutritionally deficient in iodine, also in other areas as well too, and hopefully I listed it on here, vitamin E. If you're vitamin E deficient, 95% of your iodine will not absorb. 95%. So if you're vitamin E deficient, which the majority of Americans are, good luck on iodine uptake. Vitamin A, selenium, zinc, copper, magnesium, B6, all of these found in a good multiple vitamin that absorbs, not one from your local grocery store or outlet center. We need a good multiple vitamin that are rich in absorbable forms of these types of nutrients. Autoimmune disease, Hashimoto's disease, which is becoming more and more common, whereby the body's own immune system attacks the thyroid and disables it, or disables its ability to convert thyroid hormone 3, thyroid hormone 4. It can also cause as well little tumors on the thyroid to grow. In other words, the body starts eating away at its own thyroid and it isn't going to function right. We're seeing more and more Hashimoto's. We don't know particularly why, other than potentially the nutritional deficiencies, the iodine, as well as the other nutrients, as well as potential for radiation exposure from all those dental x-rays. I had one dentist that wanted to put me through each individual tooth. I have 28 of them left, x-rays. And I said, out of here, ain't going to do it. I don't care how much protection you put over here, and make sure when you get your x-rays to do that, your thyroid is exposed to radiation, and multiple exposures can lend itself to problems with the thyroid. Progesterone deficiency or estrogen dominance. What happens is when you're estrogen dominant, it will go in and it will actually block the thyroid receptors. So a lot of women who are very overweight, who are on birth control pills, who are on Premarin or those types of estrogen replacement therapies, they're going to block their thyroid receptors, and I'll be doggone, most of my customers that come in on hormone replacement, they grow. Because obviously one of the side effects of an underactive thyroid is weight gain. My perimenopausal women, I'm seeing a lot of estrogen dominance, and then as we go through in our 40s and 50s, the decrease in progesterone levels. Progesterone helps thyroid uptake. So when the progesterone levels fall, I'll be doggone, your thyroid isn't going to function or convert T4 into T3 as readily. So those doctors who say when your uterus is removed, don't worry about progesterone, they're wrong. You need progesterone for more than just your uterus and to cycle. You need it also for thyroid support. Stress, cortisol. Cortisol, adrenaline suppresses thyroid as well. So if you have high stress, well, if you're a working mom and you have a couple of kids, you're in high stress. That excessive amount of stress hormones, oftentimes we see you gaining weight again, will actually slow the thyroid. These doctors who put their patients on these really low calorie and they use the phentermine to help speed up the ability to burn off fat. Boy, these women, they drop off weight. But I got to tell you, this excessive use of diet pills and dieting causes problems with the metabolic rate. Almost the majority of my customers who lost all their weight, they put it all back on and more after they do the phentermine and the low-calorie diets. Don't do it. There are other diets that we can do as far as weight control are concerned when you have hypothyroid. Pituitary deficiencies, and believe it or not, underactive thyroids are pretty hereditary. And if mama is iodine deficient or has thyroid problems at the time of pregnancy, we could have some real interesting problems with baby later on in life, not just including thyroid issues, but actually growth and a whole bunch of brain activity issues. Thyroid and the proper function of it is so important. I can't over-exaggerate that at all. I think one of the biggest reasons why we're seeing so much thyroid problems is because of all the chemicals in the environment. And that includes flame retardants, chemical sprays that we use like on our couches to keep things from staining, pesticides. There's some brand new studies that are out regarding those retardants and how they actually can shut down thyroid function or slow it substantially. But chemical pesticides, once again, they're estrogen mimickers, but they're very strong estrogen mimickers that can block thyroid receptors. All these chemicals, including the list that you can see here, can all contribute. And we're seeing an unbelievable amount, particularly in perimenopausal women, of thyroid issues like I've never seen before. Symptoms, oh man, I can tell you the tests that they do are very, very unreliable. We'll go through and hopefully you can copy down the proper tests that can increase your rate. The standard TSH test, which registers thyroid stimulating hormone, is only about 25% accurate. We can raise it to about 50% levels if we include some of the other things that I'll mention here. In our fitness section, we'll go through the body temperature test, which is probably one of the best ways to determine if you have an underactive thyroid. Other symptoms, however, include fatigue, depression, apathy, lethargic. You know, you just don't feel like doing anything. Weight gain, bloating, menstrual problems. I have a lot of young girls that have thyroid issues that are coming to me, and they're not cycling because their estrogen dominance and their thyroid issues, they're not cycling. Sensitivity to cold and heat. They get very cold very, very, very fast. Hair loss, dry skin, the nails start peeling, the low libido, infertility, insomnia. Look at all this, just from not having a proper amount of thyroid hormones flowing through the body. Slow healing, carpal tunnel syndrome, lowered immune, infections, dry eye. I mean, we have tons of prescription drugs that treat these individual problems, but I got to tell you, some tests need to be run. I'm going to jump here a little bit to the testing because I think it's kind of important that you recognize if we're going to have all these symptoms, this is the tests that you need to have performed. And you be very specific, because most doctors will only run the TSH, and that is totally inadequate. So, TSH, free T4, free T3, reverse T3, and they need to do the additional antibody tests to confirm whether or not you have Hashimoto's disease. Because your TSH will come out normal, and they'll say, oh, you're no problem, but you'll have Hashimoto's disease. So we need these full panel testings done, and I'll tell you, if you need any of these, they'll be in any of the vitamin herb stores. We can give you a copy of this, and you can take it into your doc and say, this is what I want. This is what the research is supporting that physicians should conduct when they do thyroid testing. Vitamin mineral analysis. Take a look. Are you missing those nutrients that I mentioned? Are you full of toxic metals? Do some hormone testing, including DHEA, estrogens, progesterone. The list is on here. Your insulin. Liver enzymes. Do you realize if you're iron deficient, which a good portion of American women are, especially if they're having all this heavy cycling because they're obviously not having adequate amounts of progesterone and they're estrogen dominant, that too can contribute to thyroid issues. So it's important you get that little finger prick and find out if you're iron deficient and take care of iron with a whole food source iron. When we're talking about diet, if you have an underactive thyroid, iodine-rich foods, including sea vegetables, yummy, yummy. I know a lot of people going, gag me. But I'm going to tell you right now, this really does aid and abet the uptake of iodine. Kelp, nori, dulse, kombucha. We have, I know in our store, these little packets are like 75 cents, and my 11-year-old eats them like crazy. And what they are is they're sea vegetables. They taste yummy, but they're very rich. Sea salt that's iodized is one of the best ways to get it. And we still require right about 2,000 to 2,200 milligrams of sodium per day. So anything in excess of that's not good. But I'm going to tell you, going on a super low sodium diet, I know we're concerned about blood pressure and other issues, but you've got to have some sources of sodium, and sea salt is also a rich way to get it if it's iodized. Eating essential fatty acids, walnuts, almonds, pecans, pumpkin seeds, those essential fatty acids help with hormonal stabilization. Now, there's a certain class of vegetables that you shouldn't eat if you have a thyroid issue, that you shouldn't eat a lot of if you have an underactive thyroid. Now, if your thyroid is overactive, you want to include these in your diet. And now mind you, when they're cooked, it neutralizes certain, the effects of them that can slow the thyroid. But uncooked, kale, broccoli, cauliflower, cabbage, soy, Brussels sprouts, those are all things, if you have an underactive thyroid, you should avoid raw. Avoid tap water with chlorine, fluoride, which inhibits iodine absorption. Get some good water filtration on your drinking water. You know, a reverse osmosis system is a wonderful under-the-sink type of system that can help hopefully filter out most of those and some of the particulates as well. High fiber diet to speed up the elimination, to get rid of all these metabolites, the estrogen metabolites, the chemicals, all the stuff that we're taking in. I think I mentioned to you that they estimate that we now in our society get as much toxins exposure or toxic exposure in one day that our grandparents got in 25 years. So, because of all the chemicals, and our government continues to ignore and find other priorities other than its people's health. Drinking lots of water every 2 hours. Once again, you're detoxing your body. Once again, clean water. There are quite a few supplements that can aid and abet your ability to deal with thyroid, particularly when it's borderline underactive thyroid, which we see a lot of. And we'll go through the basal temperature test later. But when you're borderline, even with the broad spectrum testing that is recommended, your doc's not going to give you the standard medications, which should include a T4 and T3 and adjusted every 6 months. Oftentimes, physicians are just giving a T4, and over a period of time, the body, because they're not checking, the body won't be able to convert T3 any longer, because what they're hoping is a good thyroid will convert that T4 into T3, and extended usage does not allow for that. Etomidine iodine or kelp sources of iodine can be used to help feed the thyroid. But once again, you need to have other nutrients, including a good multiple vitamin, vitamin A. In other words, beta-carotene sources ain't going to cut it. And I know a lot of people, doctors panic when they see, oh my God, she's recommending vitamin A. You have to take very high dosages over a long period of time. But if you're getting a lot of infections, that's a really good indicator that you're not getting adequate amounts of vitamin A. Vitamin E, 400 to 1200. Once again, 95% absorption reduction when you're deficient in vitamin E. Very important. Once again, a good absorbable multivitamin will cover the majority of people on that with a minimum of about 100 to 120 IUs of a natural vitamin E. Not a synthetic that you're going to find in your typical grocery store vitamin. Ester C is important for iron. Most mineral uptakes, it's important. And if you don't like the nuts, there's some omega-369 fatty acids that you can take in liquid-wise or pill-wise that can reduce inflammatory as well caused by some of the symptoms, but help in addition with hormonal stabilization. There are glandulars. Oftentimes I'll have customers will come in and they'll grab the kelp and they'll read about glandulars. Glandulars can be very supportive. They're kind of like doing like a mini support that can help feed, it's like feeding the thyroid to help induce it to function in a more proper way. There are herbs such as bladderwrack. Now bladderwrack is a sea vegetable that can be taken that can help